Good day, everyone. Whether it's evening when you're watching us, whether it's noon, or whether it's daytime. Thank you for joining in with us tonight on our 21st day of the first. I mean, it might have been some that have come before, but this is the first C.H.L.M.S Medi-Helpz Black History Month annual event. It's also the first time that an event of this magnitude has actually been on LinkedIn or on YouTube or on Facebook at a 30-day event where we're honoring those who came before us by showing them what they left, what is here now, and how we that are here now after they have left, how we're pushing forward, we're building bridges, we're just doing a ton of things. We are so engaged with our healthcare, with the things that go on, not only just for us, but for our family, for our loved ones, for our community. We're pushing forward and we're doing things that, they were not able to do without being publicly chastised for doing it. So I'm so very, very happy as the founder of C.H.L.M.S Medi-Helpz Foundation, that when I asked these 29 individuals to stand up and, come forth and let's just get this together. Let's show our community what we have. Let's give hope to those who don't have hope, who don't know anything about how the healthcare system is run. And each of them have come forward, including our guest host that we have tonight, including her. Each one has come forth and delivered without, I'm honored. I'm honored. So I'm hoping those of you that are listening to these videos feel just as honored that you have that kind of collaboration going on within the African American field of health, because we need that. And we're going to talk a little bit about, why we need that in just a few moments. I am setting up now to make sure that our LinkedIn is live, just as well as our Facebook. So please bear with me for a moment so that I can ensure that we are indeed live. And we are. So who do we have tonight as our esteemed honored guest? We have Miss J. Palmer. She is a seasoned healthcare quality leader with over a decade of experience in defining and enhancing care standards. Recognizing systemic inequities, she has dedicated herself to bridging gaps through her company, which is Culturally Elevated Consulting. She founded that company to advocate for fair and just healthcare access, meaning she, like me, believes that our community shouldn't just have access to healthcare. We should have access to the best healthcare so that we could push past better healthcare outcomes and reach the best healthcare outcomes for our community. Jay educates health organizations to ensure every patient receives personalized attention, which is so important because every patient is different. So every patient deserves personalized attention. We do not need to be put in a barrel and all of us treated the same way, roll down the river the same way. That does not need to happen. Welcome the visionary behind Culturally Elevated, Jay Palmer, as she continues to champion healthcare tailored to everyone's needs. And before we get started, before I turn it over to Jay and let her lead the educational session this evening, what I do want to say is that as you are coming in, if you have comments, please put those comments in, whether you're looking at us through Facebook or whether you're looking at it through LinkedIn. Please put those comments in so that we can see those comments, we can have those comments. Once the show is over, there will be a link available. Should you need that link because you want to share it, because one of our goals behind doing this is we want to touch as many lives as we possibly can. So should you what, Sandra, that, session that Jay gave was on point. We want to have it. We want to get in touch with her. We would like the link because we want to share it. We really know people who, healthcare organizations, executives, as well as patients who could benefit from hearing what Jay has to say. please reach out. Send me a DM through Facebook, or send me a message through LinkedIn, and I will make sure that I reach out to you and make sure that you receive the link, not just of Jay's show, but of any show. Because my motto, and I actually have those in my foundation, understanding the importance of this motto, is each one teach one. But don't just stop at teaching one. Go ahead and reach out to one, because if every one of us that we reach can go out there and teach, or everyone that we teach can go out there and reach, the circle just keeps going around and around, and we touch, and we have the expectation of touching so many more lives, and it happens when we push it forward. So I will now go ahead and turn it over to Jay.
Thank you so much, Sandra, and thank you all to everyone who has joined. Sandra, this is a an honor. So thank you so much for holding space for these conversations. I mean, it had to have been no easy feat to be able to do this. Not only today, like you mentioned, this is an everyday thing for the month of February, and even though February is the shortest month, I'm sure this was still a lot of work. So thank you so much for the opportunity. And again, thank you to all who have joined. This conversation that I'm having today, I tend to have it from a perspective of health plans and with professional, provider networks. So the opportunity to be able to share such an important topic with the general population, because I'm sure that everyone who is listening today and who will listen on the recorded session can attest that they are patients, right? We're all patients. We all have been a patient up to someone. And so cultural awareness is something that goes beyond every culture, race, ethnicity. I am talking today for the sake of Black History Month, and this event is a Black History event. I do want to point out that cultural competence goes across every single spectrum. And the work that I do at Culturally Elevated is about bringing awareness for all cultures. But for the sake of today, we are going to talk about Black healthcare. So without any further ado, I'll go ahead and start the conversation. So the key objective for today is to empower Black and Brown patients and the providers that they serve. The providers that serve them by providing an overview of cultural competence in healthcare and how it can improve overall health outcomes for you, and you. The key concepts for today would be basically I'm going to run through what are racial disparities, addressing social determinants of health, and giving you some work as well, because as patients, you also do play a role in this as well as the providers. The providers may have the bulk of the role, but patients, you do have a role that plays in the care that you get as well. So, in its most simplest form, what is cultural competence? This is a topic you might hear it as cultural sensitivity, humility, awareness, intelligence. It all kind of is the same thing, but in its most simplest form, stripping away healthcare, it is the ability to understand and interact effectively with people from different cultures. What does that mean? So basically, it's the people that you work with, you worship with, the people that you may even sit next to in the waiting room at the doctor's office. Everyone may not share the same culture as you, but how are you able to effectively communicate with them and share space with them and be able to have compassion and understanding that they are different than you. Your beliefs, your values, your practices, they're all going to be different. So in its most simplest form, this is cultural competence. So I always like to expound on the key principles that make up cultural competence. Typically in my workshops, I will kind of go in depth in all of these, but for the sake of time, I won't go in depth, but I'll just kind of highlight them. So cultural sensitivity, do you have tolerance? Do you have compassion? Are you aware that someone may be different than you? Cultural humility, understanding that you do not know it all. That's basically that's how I want to shape that. You don't know it all, but you are willing and you are curious to learn about others who share space with you. Respect for cultural differences. I think that's pretty self-explanatory. Adaptability. Now, we're talking about healthcare, right? So I do want to expound on this piece when it comes to the care that patients receive. Doctors do have responsibility to provide tailored care. Everyone, as Sandra mentioned earlier, we cannot all subscribe to the same treatment. So are you able to adapt to a person's realities? Are you able to respond to people's disparities? Effective communication, we talk about this a lot in pretty much any spectrum of life. Effective communication is definitely a key. We'll get into that a little bit later. Collaboration and advocacy. Collaboration we'll get into as well, because patients need to collaborate with the doctors and so forth and so on. So the significance of cultural competence. So the African American culture has significant influences on their approach to sicknesses, diseases, stress, and healthcare, as well as their religious beliefs and family dynamics. Now, again, we are here for Black History Month, but listen, this goes to all cultures. Everyone's cultural beliefs kind of influences or dictates how they seek care, how they go about their daily lives. And so what are the roles, what can providers do to kind of help with this? So again, don't take that one size fit all approach. That's just not going to work when you're rendering care to different cultures. Understand disparities. We will get into that a little bit later, but this is key as well. And being intentional about building trust. I cannot overstate that enough. Patients need to feel that that they can trust you with information. And we'll go over to the patient side now. Effective communication. Once that patient have identified that they can trust this doctor, patients, it is your responsibility to not withhold information. If there are any familial cultural practices that your family has done generations over generations that has led to your condition today. Let's just say, for instance, the types of food that you eat, right? Maybe you don't get the nutritious food. Maybe you choose certain other foods. These are kind of communications you want to share with your provider. Do you smoke? Do you drink? I know a lot of times we tend to not give all of all the information about ourselves, but it is so important. Again, once you build that trust with your provider to share so that they can care for you in the manner that they need to. Participate in decision making. This is a big one. This is about being an advocate for yourself. And I'm going to get into that a little bit more as well. And then, of course, getting engaged. So being engaged in your own care could go a long way, people. So I found this to be interesting. This is two different studies that I actually read an article that was posted actually last year from the Washington Post. Two separate studies that was conducted. So Black Americans in America, they had an excess of 1.6 million deaths compared to white Americans. 1.6 million in excess. That means in addition to, due to health disparities. And the study goes on to say that this equates to 80 million potential lives lost. Now, I don't know what that means as far as bodies, but it just sounds like an astronomical number. So I'm going to go with, they know what they're talking about, 80 million potential lives lost as a result to the 1.6 million deaths. Also, from a study in 2018, there was results that $238 billion was spent by the US government on deaths related to health disparities. This is only 2018 alone. I can't even imagine what 2020 would look like, or 2021 during the pandemic. I can't imagine what that number would look like, but $238 billion spent on deaths. And this is including, if you're curious, those who did not have insurance, maybe they had to go to the hospital. So those hospital costs has kind of built up. Getting care when maybe you have insurance, but maybe you weren't able to get certain care. So it's just this money comes from different pools, but it's just an astronomical number. And I wanted to share that so you can kind of get a perspective on how, number one, how many deaths are related to health disparities and how much money is being spent. So, what are health disparities? You're probably asking. So, it's the differences in health outcomes and access to healthcare between different groups of people, often based on social, economic, or environmental factors. So, what am I saying here? So, your basically, where you live, where you habitate, where you work, you go to church, all of those things can have an impact on the type of care that you have and the things that you kind of experience. And I'm going to actually go into some of the most prevalent health disparities we see today. Now, there are it's a litany of lists of prevalent health disparities, but these are the most common that we find in the Black community. So higher rates of chronic diseases. You're talking about diabetes, hypertension, things like that. Disproportionate impact on HIV. One of the ones that I want to highlight here as well is higher maternal and infant mortality rates. I think we see that we're starting to see a lot of conversation around this a lot, and I'm glad that the awareness is there. But it seems like we're getting the awareness after the deaths or the injury. So I really want to kind of hound on that as well. And environmental health, I want to point that out as well, because specifically in the Black community, you will find that there are residents who are living in homes that was passed on generation after generation from the early 1900s and probably even before then, when their ancestors told them, do not give up your land. So they're going to live and abide by what was told to them, again, generation after generation. And what do we find when we talk about environmental health? There are a lot of industrial plants or paper mills or whatever the case may be being built in these very neighborhoods. And so what happens, you having this spillage of chemicals and things like that people are living and breathing every single day. That is a disparity, and I don't think we talk about that enough. I saw some documentaries that I thought were great at explaining this, and it's very sad, to be quite honest, but I wanted to bring that out as well. Now, from a historical context, what are some racial disparities that African Americans or Black people face? Structural racism, we're talking about, low income job or low wage jobs, the education that you're going to get, things like that. Discrimination is still live today. It's not anything that has gone away. It's still here. Limited access to healthcare. These are like the top three that stood out to me the most that I wanted to share with you all. So to try to get my point across, I always like to lead with stories. I think storytelling is phenomenal. While this is a fictitious character, this story is not a fictitious story. This is a real story. I do have one typo here, and I think that this is important to mention. Jerome Parker was not born in the 50s. He was born in the 40s. And so that's my mistake for putting that there. But Jerome Parker, born in 1950s, was deeply impacted by the amended Social Security Act of 1935, which disproportionately excluded African Americans from benefits, perpetuating economic disparities in families for generations. So working in a hospital incinerator, Jerome was exposed to hazardous conditions that led to several undiagnosed and untreated chronic illnesses, shortening his lifespan to 62 years. Okay. Despite seeking medical help, he encountered physicians who lacked cultural competence, failing to understand his experience and struggles. If Jerome had equal access to healthcare and a culturally competent provider who recognized the impact of structural racism on his health, his potential lifespan could have been extended, point blank and period, right? And while, again, this story is a real story, this is a story of my grandfather. His name is not Jerome. But he did work in a hospital incinerator. He actually worked in the hospital that I was born in, so he was the third person to meet me. But yes, he ended up having a chronic illness that he succumbed to. And if I do recall, the neighborhood that he lived in Baltimore, Maryland, was an underserved community for sure. But if I recall, it only had one medical facility. It was a hospital, but when you go in, it looked like a clinic. That's just, it was overcrowded. It was underserved. It was understaffed, I should say. And I don't think that they were just kind of overwhelmed. And again, this is kind of that structural, that systemic piece that we're talking about, having more facilities in locations. So I'm going to move on from there. I want to just kind of share that story because it kind of gives perspective. Social determinants of health. These are the conditions in which we are born in, we grow, we live, we work, we age, and the forces and systems that shape the conditions of our daily lives. So, in a nutshell, what I'm saying here, this includes economic policies, system development, agendas, social norms, social policies, and political systems. Like all of these things kind of make up what social determinants of health are and how they can impact the type of care and access to care, and maybe not so much high quality of care that a person will receive. I kind of just talked about this a second ago, but social determinants of health can affect equitable access to care in various ways. But for an example, like I just mentioned with the story about Jerome, living in an underserved community, not being able to get the access to care that you deserve, or maybe you have poor public transportation, so you're not able to. It's one bus line, that would take you to the quality of care that you want to get, but then you have to walk a mile, and you have to add another train stop. These kind of things kind of are deterrents, and they are barriers for people in real life. So speaking of barriers, and I hope I'm not going too fast. I actually want to spend some time, having discussion and some dialogue around this topic. So I hope I'm not going too fast, but barriers to equitable access to care, discrimination and bias. Woo! I want to first start by saying that we all hold biases, right? That is not a secret. We all, the way that we were raised, the people who raised us, our experiences, the things that we've seen on TV. I mean, all of those things kind of shape how we feel about other cultures, other people, and things like that. It is up to us to check our biases. I do it all of the time, especially now that I'm becoming more and more self-aware. I am checking my bias on a regular basis. However, there are a lot of people, especially those who hold a healthcare professional profession. They are not doing that, and it's very sad because they are making assumptions the minute you sit in an exam room. I don't want to get into a soapbox on that one because for the sake of time, but lack of diverse representation. It is no secret that people like to go into offices and see themselves. I don't think that is something that is uncommon, and I don't think that this is a J thing. I think this is a thing. I know we're talking about African Americans, but I can just only imagine what it may feel like for someone who is Hispanic and they go into an office. They maybe have limited English proficiency, and they may not be able to articulate well. And I can only imagine what that's like if there's not one person in that room, in that space, that can advocate for them. So when we're talking about diversity and representation, it's a thing. So any provider, any even those who are making healthcare decisions like benefits for health plans, it is good to have other representation within the room for the community that you're serving. Health literacy, big one. And I should have put here digital health literacy as well, because that too, we're going into this techno space. I think that is just as equally as important as health literacy, but being able to simply understand how to navigate. If you're a person who have multiple conditions, let's just say, for instance, you have diabetes and you have heart condition, you have hypertension, it may be difficult to understand how to navigate through all of that. And so it is, bare minimum when it comes to health literacy, that is a barrier for a lot of people in this community as well. So you do rely on your provider to kind of handhold you and tell you what it is that they need to do. And I have here transportation and geographical barriers because though I'm a city girl through and through, never lived in a rural community, but my heart do go out to those who do. And I do have a special place in my heart for recognizing that there are individuals who have to drive 45 minutes to an hour, or sometimes more, just to get the care that they need. That is a problem. So these are some barriers that I wanted to kind of like bring up and hound on. So we're almost done here, but I wanted to go back to that figure that we mentioned before, that $238 billion that was spent in 2018. I have a question, and I would love for you to please leave your response and or some comments in the chat. But what if we could repurpose that money and repurpose it in a way that we're being on offense, right? And not the defense. And we are spending the money before the deaths actually happen. What if we spent that money on, being strategic and making sure that we are tackling death by disparity before it happened? Right? Wouldn't that be, I don't know, wouldn't that be kind of, I am no brain surgeon, I'm not no scientist, but to me, that's just like commonsensical, but and just a couple of things that I thought of. Again, I would love to see you jot down in the chat, but a few things that I thought of were, addressing economic disparities in healthcare, maybe having income-based healthcare plans. I don't know, but that having more of that, I think that would be a big help. People need to have health care. Without health care, people will not go get care, and without adequate health care, people are not going to be consistent with the care. Implementing widespread cultural competence training. You can hire me. That is what I do. I definitely go out and I educate provider networks, ACOs, FQHCs, VA hospitals, medical institutions, like students, before they even get out into the workforce, catch them while we can. That is very important. And actually, I'm on a side note, there is a regulation for Medicare Advantage, CMS, and the Office of Minority Health. I'm sorry, so many acronyms. The Office of Minority Health, they have regulated that certain states have to have cultural competence training on an annual basis. So you might want to check that out if you are a provider in those states. Invest in community health centers. We can use the money for that. Again, promoting diversity in the workforce. I mentioned that before. We can use money toward that. Increasing research and data. It is so important. Data is so important, people. If you do not have the data, how do you know what to address, right? And so whether you're collecting the data in, a new patient form or a health equity assessment or whatever the case may be, you can start to ask those very critical questions to your patients about their lifestyle, because you want to be responsive to their reality. If you don't know what that reality is, how can you? So asking questions about transportation to healthcare, or maybe, food insecurities. Some people, especially from this community, Black community, they will prioritize working over taking care of their health. They will prioritize getting food in the refrigerator over buying the medication. So I think it's important to understand the people that you are serving, the community that you are serving, and maybe you will be able to advocate a little bit better for them. And that goes to number 6, advocating as well. So very last slide here. I'm very eager to have a conversation, but what role do you play? And so as a provider and as a patient, again, as I mentioned before, at the top of this conversation, everyone has a role to play. So as a provider, self-reflection is going to be important. We talked about cultural sensitivity. We talked about cultural humility, checking your biases at the door, all of those things. A respectful and effective communication. You cannot speak to your patient with all of this medical jargon that they're not going to understand. But effective communication could look like chunking, where you're taking bite-sized pieces and you're giving it to them, instead of saying, hey, here are the 8 pills you have to take. You take 2 or the half of these pills on Tuesday, and the other 4 on Thursday. Like, no one's going I wouldn't understand that. So being able to effectively communicate so that they can understand what your treatment plan is very, very helpful. Path to understanding, advocacy, continuous learning. We kind of talked about some of those. Now to the patient side. Self-advocacy. You have to be willing to understand, what's going on with your body, doing the research, checking your Googles, making sure that you're tapping into your conditions. Shared decision making. I think that I haven't seen a study on this, but I'm willing to bet. I'm not a betting woman, but I'm willing to bet that if patients were a part of the decision making process, they would probably be more likely to adhere to the treatment plan and adhere to medications and things like that, because now they're feeling like, okay, I was a part of this treatment plan. I expressed to the doctor that I only walk on Wednesdays, Thursdays, and Fridays for 30 minutes. So these are things that I can implement. This is just an example. Voice your experience, health literacy. I kind of talk about that in self-advocacy. Do your Googles, do some research, tap on your grandson's shoulder and ask him to help you explain or find, information on the internet. Seek support. A lot of communities, I'm starting to see more and more, they have nonprofit organizations, they have community advocates, they have support groups. Those who have diabetes, come along, let's share exercises together, let's share recipes together. Tap into those support groups as well. And most importantly, last but not least, I would say to provide feedback to your provider so that they can make the adjustments as necessary, or keep things the way it is. Provide, we tend to get inundated with surveys, but I am a survey taker. I take surveys because I want you to know that I enjoy the care, especially when it comes to the care for my child. I want you to know that this was great. You helped me. You saved my life. Or not so much. So people cannot make adjustments if they don't know. And surveys come out sometimes 5 times a year, sometimes after each visit. I would suggest, as patients, that you participate in the surveys. So that is it for me. I know that was a mouthful, but I truly hope that the audience was able to glean something from that speedy presentation.
You did wonderful.
Oh,
I
thank
am
you.
so happy. I know you were nervous and you was like, but Sandra, I really do, do it mostly for the provider side, for the facility side. Like, how can I do this? And as I stated when I spoke with you earlier, yeah, but the patient also needs to know, what does it look like when diversity isn't there? Like, what
Yeah,
does it look like when you go to the doctor's office and a person is having a bad day, versus you go to the doctor's office and they're just not culturally trained, right? It's a
yeah,
big difference. And so you really need to actually pick out the difference and, see the difference, recognize the difference. And once again, as everyone has been saying this week, and as I always say, whenever a patient tells me about something that has happened to them when they were at the doctor's office, well, who did you tell? And if you
yeah,
tell me nobody, then who are you to blame? Like,
yeah.
voice, your voice is the most precious tool you have. You need to get comfortable with using it. And I understand that there are some people who don't like to talk a lot, right?
Yeah.
They shy away from talking. Grab you a buddy. Grab you a buddy.
You're talking to Buddy, right?
Right. To talk to somebody and say, hey, this happened to me. How do I handle it? Or can you handle it? And a lot of times, in a lot of places, another shout out to my lovely cohorts in the independent patient advocacy world. That's what we do. We speak out for you. We help you. We
Yeah,
assist you with speaking out. It's a big difference, when you are looking at an advocate, and this is not about the advocates, but there's a big difference when you're working with an advocate that works for a facility, because the facility advocate has to take the facility side, at least if
that's
they
right.
want their job and they want to get paid. An independent advocate, well, hey, we could tell you the things from A to Z because we don't work for anyone. So we have an opportunity to tell you everything. But all of us as advocates and in that advocacy world, come to us and let us know, hey, I need help. This is what's going on.
Yes.
What I was told was that there were some people who were trying to get in that did not get in. I don't know if it's a LinkedIn issue or not.
Oh
I'm
no.
sure
Okay.
they heard me because it was showing me how many people were in the room. So I'm sure they heard me. I'll actually have to check with LinkedIn to see what occurred and why people were not getting into the room. But this is a thing for those of you who are listening. If you have a comment, please put it in a comment. Please go to the upper right corner. You'll see
I click
three
it there.
dots. You'll be able to click on that dot. You'll see comments. Put your comments in that box, especially if I don't go over the one that we were brought up. If I don't go to it, because what I want us all to walk away with, my goal this entire month has been to make sure that at least one person walks away with some information that they did not have prior to coming in and listening to any of our rooms or going back and retracting and listening to any prior room. I'm just really hoping that one person, and of course, I'm always told Sandra, I got so much from that session. I really did. This is helpful. I get so many, positive comments in reference to running these rooms, running these events. So I'm thankful for that. But by all means, please put your comments in so that Jay can answer them. She will get them.
Yes.
She will answer them. If she can't answer them, she'll get back to me and say, hey, Sandra, could you answer this for me or whatever? But we'll make sure, it's a promise from me to you, we'll make sure that your comments get answered. I do have Darlene Christie. She said, hello, this is Darlene Christie.
Hi,
Uh,
Darlene.
and then Lisa Dobson writes, great points about remaining curious and really understanding the patient needs to collaborate and advocate. That's a thing that if we as African Americans that have watched these videos this week, have this month, have not learned anything else, we have learned to use your voice to speak to your doctor. These are rooms that are being put out so you'll have resources and options. But please don't take these rooms and say, well, I don't need to talk to my doctor because that girl said or whoever said or whatever. Don't do that. Use the information that you've been gleaning to do
Yeah.
what Lisa has said in her closing sentence, where she says, always learning. We should always be learning. As patients, we should be learning. We should be asking questions. Well, that doctor don't do this. Where can I go to find the doctor that does what I need? How, once again, in reference to Jay's speech to speak tonight, know the difference between this is what a staff looks like that is not culturally competent. They don't understand what competency is. They have no idea. And you can tell by the way they're treating you versus the way that they're treating someone else. I mean, how many times have we heard stories of people that have dressed up to go get something and been treated so much better than someone that actually is, looking bummy, for a lack
Yeah.
of another word, right? That person that's looking bummy, maybe that's just what they felt like putting on today. Why treat
Right.
that person different because
Yeah.
they don't look like you want them to look, or you making up once again, as Jay stated earlier, you're making up this biased decision about what's going on with that patient, right? And
Yeah.
and so I've said this all week, right? These conversations are not just for African American patients. They are for all patients, not with the diversity issue, but with all of the issues that we've been speaking about. What we have to stop doing is looking at things black and white. That's what we have to stop doing.
Amen.
Taking it off, take that mask off, and deal with each person as a human versus
That's
as
right.
a black person or a white person. Because that division right there is never going to get us anywhere. And if it does, guess what? You're gonna come right tumbling right back down because you're looking at it from the wrong lens. Jay, I do have a question for you before we
Sure.
close out for the evening because we're at like 6 minutes. So I have a question for you. You brought up something in reference to the environment, and earlier during not this week but the prior week, we had UN Peace Ambassador Dr. Angela J. Neely on, and she brought up the issue of environment, and she brought up the issue of environment and how it impacts us. But she didn't bring it. Well, I'm not gonna say she didn't bring it up in that way, but it really wasn't about the diversity issue. But what it was about was environment and how environment literally tears our communities apart, like
Yes.
negates our communities. Because she was, you basically repeated the same thing she did. I mean, we're living in these dilapidated buildings, in these
Yep.
buildings that they're not supposed to have, lead in them, and they're not supposed to have this
Yes.
kind of housing component, but yet they're made with these types of materials which get into our bloodstream and get into just our whole psyche, mentally and physically, those environmental issues. So from the diversity standpoint, when we talk about economics, which is one of, and it continues to be, I say this all the time, we have a healthy people 2030. Well, we're working on healthy people 2030 now, right?
Yeah.
It's been 12 healthy people 2000, 2010, 2020, 2030. And what appears to me to be happening is that those same factors, which are
They're still
all
there.
factors that detract, those all factors that actually negate the health condition in the African American community, environment is one of them. That's not a new topic. So how do you think that we can move past that being a topic as far as diversity is concerned?
That's such a great question, Sandra. And honestly, I wish there was a one stop shop approach for that. As I shared in my presentation, I have actually seen a handful of documentaries lately, specifically on health equity, right? And what the common theme is, I've seen where a lot of the neighbors, they man, there was one I just watched called The Descendants on Netflix. If you haven't seen that, and I think another one I'm thinking about is What the Health, I think is the other one. But these documentaries kind of, whether it's a widespread conversation or not, if they really do kind of hone in on, you know, I've heard a few of the neighbors, they say, they can start naming off the neighbors or their family members who literally have died, I mean, at young ages of cancer or other chronic illnesses, diseases. And they are standing fast that they're not going to move because their ancestors told them, do not give up your land. And I think that I think there's a pride that's set there. And I think if you take that pride and you take that, I think they are advocating for themselves. I have seen where a lot of these residents are, advocating for, it's the redlining. Then there is like, these developmental agendas that are going on that supersede these residents' claims. And so, putting up, like I said, paper mill, with one of the documentaries that I saw was sad that the kids thought it was a fun thing because it was like snow. It wasn't snowing because this is in the South at the time, but it was just the paper that was just pieces of the paper that was in, and they were breathing this stuff in. They thought it was fun at the time, and everything was white, looking like it was a white, like it was snowing outside. But the aftermath of that is that they were breathing in these chemicals, this paper particles. They're going into their lungs. They have advocated, and I don't know what more is it that because these communities are small and they're in little small pockets that people don't really care, or are they suggesting, well, we offered you money, we offered to pay you to move, you didn't want to move, so now you have to deal with the consequences. Like, I don't know, the full gamut of that, but I think it's something worth discussing, and I think that it's something, it's important. And then of course, not only do they live there, but they are burying their loved ones there from like centuries, So that's another reason why they don't want to move and uproot themselves, because their loved ones are buried on that same ground that they are living on. So, like I said, I don't hear it talked a lot. I'm glad that you said that other speaker did mention it. I think that the more we kind of keep talking about it, these are disparities because, again, and I didn't mention this in my presentation, and I want to say this really quickly, that intersectionality is a thing. So while you have some of the people that may have low income or low wage and no insurance, a lot of these individuals that we're talking about, they have multiple disparities. And so that is why I said, and I stressed on that one point about data. And not only am I stressing that, CMS is stressing that. The Office of my HHS is stressing it as well. That's part of their priority for health equity 2022 to 2032. I believe that's the dates. But that's one of their 5 priorities is to expand data. And how else can we do that? Maybe in your EMR system, you started adding, crucial questions like I mentioned before. We have to know who we are serving. And that way you can maybe advocate. If once you become a trustworthy physician, you can start to advocate and speak up for your constituents. And I think that's the key. I mean, it's not one person that can do this. It's not one neighborhood. It's not one community. It has to be many voices, I think, and putting in that work with community advocates, with your local, your state, and your federal government as well.
So, with that being said, I do want to take the time to thank you very, very much for taking time out of your busy day. Once
Thank
again,
you.
if you have a comment that I haven't read because I haven't seen it, please do go ahead and put it in the comments. I am sure that Jay will respond to it. And just knowing her, and it's been a pleasure, having met her through LinkedIn. It's been a pleasure, chit chatting with her at times about cultural issues, about diversity issues, those inclusion pieces. We have to keep our eye on it right now, right?
Yeah.
Because they're trying to do away with DEI initiatives. They're trying to do away with it, not realizing just how many people are going to be hurt by it. Not just African Americans, but all cultures will be hurt by the fact that they remove DEI, because not many people. I had someone on, Dr. Joseph, on, I think it was like 2 weeks ago, from the SDIG group, and he mentioned it. He was like, well, big problem with diversity is that many people who work as diversity officers, they have no idea what diversity is, right? So if you remove it, not knowing what it is, how's anybody gonna get any help?
That's right.
So with that lovely smile of yours, before we get discharged from you, can you give us like 2 or 3 tips that you want us to walk away with? If you can give us 2 for the providers and 2 for the patients to remember as we continue to grow forth in 2024, I'd be so appreciative.
Oh, sure. I'll probably restate what I've stated just because it's top of mind right now. But for providers, you know, um, again, understanding who you are serving, take away, strip away of those biases. That is so important. And be open-minded. Just because a patient comes into your office and maybe they are morbidly obese, let's just give an example, and they might carry a couple of different conditions. Don't just assume that they're not trying, they're not willing, they don't want to get the help, and therefore you're going to just give them a very generic treatment plan and say, well, this person's not taking care of themselves anyway. Like, don't, try to strip away and check your biases. And I always think that if you just kind of put yourself, and I know this is like a cliche thing to say, but if you just put yourself in someone else's shoes, that might help a little bit. Patience. It is so important, as Sandra stated before, and as I mentioned, advocating for yourself, and being honest about your familiar traditions, sharing your cultural beliefs. If you are a person that don't really believe in Western medicine, don't want to take medications, you believe in maybe trying a holistic approach, or maybe you believe in prayer only, I think it's important that you share that with your provider so that they can maybe adapt to your beliefs and your practices and maybe try to help. Maybe they can go and do some research and say, hey, patient J, I understand what you said. I do not typically do this, but how about we try this approach? Now that's tailored care, that's trust, that's you speaking up. You're part of the decision-making process and you're advocating for yourself. It's all the things. So that's what I would really impress upon you all, because I know those who are watching now are patients. We're all patients. So advocating for yourself and for your loved ones. And yeah, I'll close with that.
Thank you so much. And so I want you to continue to enjoy your day. I want everyone that's watching, no matter what time of day or night or evening you're watching this, please continue to enjoy yourself. Please continue to do what you must to not only protect your own health, but protect the health of your family and your community. We all, we rise together. Patients rise together. And the only way we can continue to rising is if we do what we must do in protecting our health. So with that, I'll end this session. I have a treat for everyone tomorrow. I'm not going to say who the treat is, but I have a treat for everyone tomorrow. So stay tuned and I will see you tomorrow. Thank
Bye bye,
you.
everyone. And thank you so much for joining. I appreciate it.